Welcome, everyone. The numbers are starting to rise, and so excited to have you join us today. Starting to see some familiar friends and names and faces even. Appreciate people with their screens on. If anyone is comfortable having their cameras on, please, that's very welcome here. We have participants joining today from, from the registration. There's supposed to be about 50 different healthcare organizations, maybe even more, from all over the United States and Canada. For those of us dining in from the central or eastern sides of the continent, happy midday and good morning to those on the west side of the continent.
Jumping onto a webinar about healthcare institutions.
Has anybody joined from Australia? I know we had a significant amount of registration from our friends in Australia, mostly from New South Wales, Queensland, and Victoria. But part of me hopes that you're not actually here because it would be 3 a.m. But if there is anyone here from Australia, put your name in the chat, and I promise I will pause the middle of the presentation so we can all give you a standing ovation for your dedication. My name is Adam Miller, and I'm a Senior Vice President with CCS Fundraising. And I've had the wonderful privilege and honor to partner with healthcare organizations my entire CCS career, spanning across the full spectrum of healthcare organizations. And that includes health systems, hospitals, pediatric institutions, disease-specific organizations, academic, medical, policy organizations, the whole gamut. So excited to be here with you all today, and also excited to be joined by my colleague, Sarah Crazen.
Good afternoon or good morning, everyone. So glad to be here today. My name is Sarah Crazen. I am an Executive Vice President with CCS. I provide leadership to our Boston-based office, where I'm calling you from today. Just celebrated my 10th year with the firm after taking what I thought was a short detour into the nonprofit sector from political fundraising. So here I am a decade later, still having the privilege to partner with lots of nonprofits, including many in the healthcare sector like Adam. And when people ask why I've stuck around for so long, I often think and reference the framework from Bill Gates that philanthropy can innovate where markets won't and governments can't. And for those of us working to advance philanthropy related to healthcare, science, research, technology, that feels acutely true, especially given the past 2 years we've had. So thank you to all of you for everything you do every day. Adam and I are really looking forward to the discussion, and we do hope there's a little bit of interactivity throughout. We'll talk about that in just a second. And on that note, let's preview the agenda for what we're going to talk about. So to lay some context, I have the distinct pleasure here of providing the 30-second CCS commercial break. And like Adam said, we see many friends and clients on the participant list. But for those of you who may not be familiar with CCS, we are the largest philanthropic consulting services firm in the world. This year, we're celebrating our 75th anniversary. We're also proudly a generalist firm, and we work deeply across all sectors of the nonprofit ecosystem, including very deeply in healthcare. We've also been a longtime partner of the Lilly School of Philanthropy at Indiana University. So Adam is going to start our discussion in just a moment with the most macro of macro views based on the decades-long Giving USA report. Much of that data is not going to be new or surprising to most of you on this call, but I know every time we facilitate a discussion on the broader landscape, it's a helpful reminder on where to focus our limited time and energy. CCS during the pandemic, we also began conducting extensive pulse surveying to determine how sentiments and strategies were shifting for our nonprofit partners in real time. So that's going to be the bulk of our discussion today. The data we're going to look at comes from the 5th edition of that survey. And again, I know many of you on this call have participated in those data collection efforts over the past 2 years. So thank you so much for that. A little bit more housekeeping. Please do drop questions in the chat throughout. We'll get to them either in real time or at the end. Just a reminder that Adam and I are practitioners, not academics. So although we know the data deeply, we present on it often. If there are questions that require follow-up or a deeper dive into the footnotes, we'll be sure to get back to you post-presentation. And then finally, we have the option and opportunity after the presentation today to join Adam, me, and other CCS facilitators in smaller breakout rooms at the end. So In those rooms, we're going to be facilitating some conversation about how your staffs are navigating the evolving hybrid world. We'll have some dialogue about how you're retaining and attracting talent. If those topics are of interest to you, and based on our day-to-day conversations in the sector, we think they'll probably be of interest to many of you. We look forward to welcoming you into a breakout room for about 10 minutes at the end to exchange ideas and meet a few new colleagues. So finally, before I turn it over to Adam to get us going into the data here on the topic of both interactivity and the hybrid world, we'll start by breaking the ice just a bit so Adam and I don't feel like we're speaking into a void quite so much. So we'll ask you if you're comfortable, go ahead and drop into the chat, where are you joining us from? And the pandemic question, are you wearing hard shoes or slippers at present? So I took the train into the office today, so I'm definitely wearing hard shoes. But please drop a note in the chat. Let us know where you're joining us from so we can get to know each other just for a few seconds. And then Adam will take it from here and get us into the data.
The one of each.
One of each, I know.
I think I kind of need proof. I wish that there was some proof there. That's excellent. Thank you, Sarah. So I guess while people are doing that, maybe even just one more very quick and formal poll. I'm also curious how everyone's March Madness bracket's doing. If everyone had picked the all of these Final Four contenders, love to hear that. That's great. Let's start by orienting to today's philanthropic landscape and the report data. And I love seeing all of the chat action, and we'll continue to look at that. So thank you all for participating in this. So before we get into the healthcare specific survey data, it's important to set some context surrounding the overall state of philanthropy. And as Sarah mentioned, we're going to just take a refresher at some of the Giving USA data just to provide that context. So in the chart that you'll see in a second here, giving has steadily and readily increased over the last 40 years. And it has generally been on an upward trend, which is great. And in fact, charitable giving in the United States reached an all-time high in 2020. And as you can see there, it's at $471 billion with some change as well. And while the 2021 giving data is not yet fully available, the initial estimates have it indicated that giving in 2021 was up to close to 1.5% through the first 3 quarters, I guess. And we'll see in the next couple months how that plays out in the Giving USA report. But it's a very positive indicator, though perhaps maybe not keeping up with the rise in inflation, which of course has been something that we are hearing a lot about recently. As we look at the specific sectors as it relates to the composition of fundraising revenue in the next slide, you'll see that religion continues to be the largest charitable sector year over year. And that has been the case for quite some time, but religion's grasp in the pole position seems to be slipping as its percentage share of overall charitable giving has been decreasing steadily. So health, as you can see there highlighted, has received the 6th largest share of philanthropic support, and it accounts for about 9% of total charitable giving, but coming in at about $42 billion. So with that context, I think we're now able to get into the more specific information everyone came to hear about, which is the Pulse survey and what your colleagues and comparable organizations are thinking about the outlook in 2022.
Thanks, Adam. So as I mentioned, when the pandemic started, CCS quickly decided, it'd probably be helpful to gather some data points to measure how nonprofit leaders were feeling about fundraising in the current philanthropic climate, and also what they were actually experiencing in terms of results. So as I mentioned, we've since done 5 surveys, giving us a glimpse into how thinking has evolved in real time. And we also know there are a few sectors that love a benchmarking report as much as healthcare, though independent schools might give you a run for your money. And we also know that healthcare fundraising can be just notoriously difficult to benchmark. So there is incredible diversity in terms of organizational structure, how institutions report fundraising totals, the size and competitive landscape of an institution's market, and so forth. So just to set some context, the next two slides at a very, very high level show the institutions who responded to our survey. As you can see, the respondents represent the diversity of the sector well, though of course it doesn't directly map to the demographics of the sector overall. So our team had a bit of a tall order as we considered the takeaways for this particular webinar. It wasn't surprising to us at all that in earlier versions of the survey, there was a lot of consistency in other sectors. So arts and culture uniformly reported devastating impacts. For example, human and social services were more likely to consistently report significant fundraising increase. But healthcare respondents, again, they've represented much more of a mixed bag. So just thinking about the takeaways and framing out how we are going to provide some actionable insights to you all. As we consider the diversity of respondents, consider the diversity of folks joining this call, we decided to focus on a few themes that were relatively consistent regardless of size, scale, or institution type. So Jenny, if we could just advance 2 slides forward to the themes, that would be great. These themes included ever increasing optimism around fundraising, particularly as we entered 2022. Adam's going to talk a little bit about that. Adam's also going to talk about the top strategy challenges that teams are facing, regardless of size and scale. There's a lot of consistency there. And then I'll be back a little bit later in the presentation to talk about the evolution of events, the evolution of campaigns, and the increased focus on DEI or ED&I initiatives across the sector. So there's a lot of themes, actually, a lot of consistency, not only within this sector, but across the board when we look at how the fundraising sector overall is responding to the current moment.
Thanks, Sarah. And we're excited to share, as Sarah mentioned, that healthcare nonprofits are generally optimistic about their 2022 fundraising outcomes, which is obviously great. And on the next slide, you can see that our healthcare nonprofit survey participants were asked to anticipate how their fundraising programs would perform in 2022 in comparison to 2021. And that teal color at the bottom there represents the percentage who believe they'd see an increase in performance. The navy blue is those that would stay the same, that anticipated those programs staying the same. And then I guess I don't even know what color that is. Seafoam green? Seafoam green? Yeah, I'm gonna go with seafoam green. That represents an anticipated 2022 decline in fundraising revenue. And that teal color, the increase, is by far the most widely projected performance outcome across all the fundraising programs, or almost all, which is wonderful. And even better is that the amount of organizations that anticipated a decline in fundraising is very small. That's that seafoam green. It's barely visible across the chart. And amongst those organizations who fundraise for major gifts, 63% expect an increase in fundraising results in 2022, and 18% say they expect results to stay the same. Only 12% are expecting a decline in major gifts. At least half of our survey respondents also indicated that they expect an increase for mid-level giving, foundations, annual appeals, and planned gift commitments. Even event fundraising, which as we all know, has likely seen the most dramatic change since the start of the pandemic, is showing some promise and stabilization. And since this is a comparison to 2021 fundraising, which, as we just saw a few moments ago, is anticipated to be one of the highest, if not the highest fundraising total ever in the United States, these projected fundraising forecasts directly from healthcare organizations is very promising. But while it's great to gain survey participant views on the future of fundraising programs, we also wanted to uncover the fundraising challenges that are anticipated and expected by our healthcare organization friends. So before we reveal those findings from the survey, we wanted to actually take a live poll of this group. You should see a survey box pop up on your screen, and we would love for you to guess what the survey participants said was their top fundraising challenge. I guess this is like Family Feud then, right? I don't know what that makes me. Who's the host now? Is it Steve Harvey? So how does he do it? I don't know. We asked 94 healthcare organizations what their top fundraising challenge in 2021 was. Put the top 3 on the board, please. And we'll give it one more second. And let's see what the results were. Here you go. Donor acquisition with the highest polling from this group at 41%, donor retention at 34%, and leveraging data to make better decisions at 25%. Thank you all for participating. Let's see how everyone did by looking at the actual survey results. On the next slide there, please. So when asked to select the top 3 fundraising challenges their organization is facing today, healthcare respondents most frequently cited donor acquisition. So congrats to those, you got it right. Leveraging data to make better decisions was number 2, and donor retention and stewardship was the 3rd top challenge cited. Interestingly, things that were more pressing a year prior, like budget cuts and the shifting donor interests and adjusting to a digital world, those no longer are rising to the top within healthcare organizations, which I think is interesting to note. Separately, on the next slide, we also asked organizations to rate the knowledge of their fundraising staff across a variety of areas. The left-hand side in teal represents high knowledge, while the right-hand side is little to no knowledge. So if you look at the responses here, organizations were most likely to report competency of their staff in event planning and board relations. But interestingly, only 27% of respondents said their staff was completely knowledgeable in major gift strategies. And only 16% said their staff was completely knowledgeable in gift planning. And these responses are perhaps unexpected when comparing them to the optimistic forecast for both major giving and planned giving that we described a few slides back. And this disconnect between expectation and skill level suggests to us a tremendous opportunity for investment in those particular areas to help organizations actualize that anticipated growth in these areas. On the flip side, there is consistency between some of the biggest anticipated challenges and staff capacity. With the use of data and CRM being listed and donor acquisition retention being some of the biggest challenges, there are also some of the areas with the lowest rated staff capacities as you look at data-driven decision-making and even CRM database use and prospect research. So I think I'm going to go over to Sarah for some additional insights.
Thanks, Adam. And we're going to do another round of, I was going to call it low stakes trivia, but I like the Family Feud analogy. So it's my turn to play Family Feud. So we're going to talk a little bit about practices that organizations are keeping that emerged or evolved in our immediate pandemic influenced world. So again, we'll pull up the poll question for you all here. Curious what you all think. What is the #1 answer from institutions that responded to our survey? What is the top practice that organizations are planning to keep for the long haul in a pandemic influenced world? We've stopped using a post-pandemic world. I don't think we're ever going to truly be there. Pandemic influenced is the new vernacular we're using at CCS. What is the #1 practice that healthcare organizations are planning to keep? Let's give it one more moment. Okay, survey says, fantastic. So majority, and this is probably born from experience from all of you, part-time or occasional remote schedules rising to the top, and then a good contingent of you mentioning enhanced social media presence and virtual events. So let's see what the data we collected mentioned as the top practice that people are keeping. And those of you who guessed virtual events, you were right on the money there. Just over 2/3 of healthcare respondents said that they plan to continue the adjustment to virtual events. The second place response, 63% of respondents reporting planning to continue some level of remote work. And you'll notice only 1/3 of organizations reported that they are continuing full-time remote work in the pandemic influenced environment. And I know certainly I'm sitting talking to you from the financial district in Boston. I think a lot of people are coming back to a hybrid work schedule, and we'll talk in the breakout rooms about what that's looking like in practice for all of you. And then we weren't surprised at all to see enhanced social media presence and digital giving very solidly in the top 5. So just beyond another record-setting year in terms of dollars given, 2020 was a record year for online giving. So the Blackbaud Institute has been tracking online giving for about 20 years. And that study that came out in 2020 said that it was the first year that online giving surpassed 10% of all giving, which was surprising to me. It still is a bit low, but the first year, 2020, first year to surpass 10%, it was about 13% that year, and 2021 had very similar strong performance. So continued investments in social media, digital giving, we're definitely seeing a lot of conversation around that. We also heard through our surveying that DEI efforts are being prioritized in new ways. And this last poll question we have for all of you, it's not trivia or Family Feud so much, but more curious about folks on the call and wondering, for your institution, are you actively including DEI or ED&I in your strategic plans for future fundraising priorities? Are DEI initiatives actively being discussed as you set your fundraising priorities or fundraising direction this year or for future years? So we have, of course, the yes or no options. Also, I imagine some institutions, this may be actively under consideration. So let us know what your institution is doing right now related to DEI or ED&I. All right, let's see what the responses say. Yes, yeah, no surprise, and delighted, frankly, to see no one answering no. And again, not surprising to CCS when we look at the data and think about how organizations responded to us in our most recent data collection effort. Moving to the next slide, we'll see just a more granular view into how respondents told us they were prioritizing DEI and also thinking about incorporating this topic into conversations with donors. So this is, again, amongst healthcare respondents to our survey, just under half reporting that DEI are actively part of their strategic plans for future fundraising priorities. And then on the right-hand side, 85% of respondents saying that they are discussing DEI with their donors, actively discussing DEI with their donors, at least occasionally. And worth noting that when we asked respondents to answer this question for us, they were asked to consider an expansive definition of DEI, addressing a broad set of identities, so race, ethnicity, gender, religious beliefs, sexual orientation, ability, other visible and invisible traits. So again, not surprised to see the live results in the room here today, and then it's very reflective of the broader survey set that we did. We also asked respondents on this topic what tactics their organizations have employed over the past 2 years to make their fundraising activities more diverse, equitable, and inclusive. More than half of respondents reported making changes to board recruitment or board relations practices. And again, about half saying, on the next slide, I think we accidentally went back one, about half saying that they are offering DEI training to fundraising staff and or their board members. So it's certainly something, I think we've seen these numbers tick up over our survey sets. Certainly, I think we'll continue to see growth in these numbers. And again, we saw it in this room today through your survey responses. And then finally, no surprise to most of you on this call, the last trend we'll speak about, campaigns, they live on. About 63% of healthcare respondents in the survey say they are intending to undertake some sort of campaign activity this year. So whether that activity is planning, launching, continuing, or restarting a campaign. We're still seeing a lot of organizations restarting campaigns that were paused in the immediate aftermath of the onset of the pandemic. About a third say we have no plans for a campaign right this second, but Adam and I certainly know in practice that just because there are no firm plans right this second, it's usually immediately on the horizon. And then a small percentage saying they're just not sure yet of the organization's plans. And at CCS, we work obviously across all areas of philanthropic services, but campaign planning and management is our core competency. So we are getting a lot of questions about this topic right now, specifically about the competitive landscape for other campaigns. And having now lived and managed campaigns all over the country at this point, in times of economic optimism and economic uncertainty, my personal refrain has become run your own race. So Adam and I would be the last people to say to you that there's no competition for the philanthropic dollar ever. There's always going to be a degree of competition. There's always going to be a degree of economic uncertainty, but our posture tends to be with a strong case. If you can test it amongst your supporters, make plans with your institution's strengths in mind. Again, not surprised at all to see a lot of institutions forging ahead with their campaign plans. So that's it for the high level data. And before I turn it back to Adam to MC any Q&A and discuss logistics for breakout rooms, just a reminder, there is a lot in this report. We took just a snippet of it today. If you are interested in exploring more findings from the deeper report, please download the full CCS Philanthropy Pulse. There's a QR code, there's a link. I believe we'll be emailing the deck and the link and other materials to all the participants on this call after the fact. So there's a lot more where this came from. If you'd like to dive deeply into the data, we certainly encourage you to do so. So Adam, I'll turn it back to you and we can wrap up with some questions and move into our breakout rooms.
Sure, and I don't know if there's going to be any questions for that the group is interested in. It looks like, I think I saw a number of questions in the chat, but I believe they were all addressed. But wanted to take a moment and see if there's anyone who has joined that has a burning question and would like to unmute or turn on the screen or put it in the chat. And if the answer to that is no, then we can move on to the breakout rooms, but I'll just give it a minute or two. Okay, I'm not going to go full 2 minutes. That would be excruciatingly long. But here we go, a question. Thank you, Craig. How often do we do the pulse survey? And are we doing it quarterly at this point, Sarah? I know that it seems to be changing. We were doing quarterly COVID pulse surveys. At this point, I'm not sure if any of our colleagues on the line have that answer, or Sarah, if you know. Otherwise, we can certainly follow up. Looks like the answer is annually, as I filibustered. So great.
Well done, Adam. And yes,
we
did do, this again is our 5th edition. So we've done 5 in the past 2 years, and we'll be moving to an annual cadence moving forward.
Great. Seeing a couple of other questions in there, and Sarah or anyone else, I would urge you all to jump in, but a question from Brett. You mentioned you would like to know what the average length of active campaign activity is in years for healthcare institutions. I'm happy to share my perception and observation, but would absolutely open it up to this group. You have the real-time data and what your organizations are doing. I would say it depends on the type of organization, the size and the scale of the campaign, and whether or not it is a special purpose campaign for a particular rationale or a more comprehensive effort. But on average, I would say probably in the 7-year range, maybe even a little bit greater for bigger campaigns, for bigger institutions. But does anyone else want to drop in the chat or otherwise share their views on campaign length? Okay.
You have the definitive answer, Adam. I think.
7. The answer is definitively 7. So,
thank you, Brett, for the question.
Yeah, there's a couple more. Sarah, please.
Yeah, there's a question in here about segmentation of the data. So we do have, and I moved through the slide pretty quickly, segmentation of the type of respondents that we received. We don't segment the data and the responses so granularly. It would just become too small of a sample size to see any immediate trends. But again, you can see generally the types of institutions that are responding. And Jonathan, if you want to follow up after this session, if you have a specific question about a specific type of institution. Maybe we can exchange email back and forth and see if we can provide you a data set if it's big enough. But for the broader report, we separate only by sector. We don't go the next layer deeper in terms of type of institution.
Thanks, Sarah. And there was also a question by Jesse McCauley about success with fundraising for DEI priorities. Does anyone have anything that they are able or willing to share, positively or negatively, as they're approaching their DEI priorities in fundraising? Jen Belvo, I don't know if this is, I don't know if you're the only person that can speak to Allegheny Health Network, but I wonder if it's worth sharing at least the interesting steps that they've taken as it relates to fundraising for DE&I and the new position they've had. Might be worth sharing as a novel approach.
Adam, absolutely. I was actually typing it into the chat, so this is probably easier if I just speak. I work with CCS, and we have been partnering with Allegheny Health Network, a hospital system in Pittsburgh, Pennsylvania. We've been working with them for the past 2.5 years, I think. They have recently hired a full-time DEI-focused major gifts fundraiser to their team. And this is the latest step of, I would say, at least a year, 2 years of a focus on not only their DEI efforts in the community, but partnering very strongly with the Vice President of Diversity, Equity, and Inclusion and her staff from the development team. So Ellie Quick, the Chief Philanthropy Officer, very frequently partners and attends events and does solicitations with the hospital systems head Vice President of DEI. And now this new role, although based in the development team, also has a dotted line relationship to the Hospital Network DEI team. And they have worked really closely together to define what DEI means for the hospital network and for their development activities, to identify ongoing work that already supports the goals of their DEI initiatives, and to identify new areas across their institutes, their hospitals, and their practice areas where these two groups can partner together to help fund additional new DEI activities. So it's very, very closely integrated, and they have been seeing a lot of success from the community and from their donors.
Thanks, Jen. Thanks for sharing. If there aren't any other comments or questions from the group, it might be the appropriate time to go into the breakout rooms where we can have a little bit more discussion about the hybrid world, about recruiting and retaining your top talent, and for anyone that's feeling like networking a little bit and meeting some colleagues and friends. So I guess we will go for that. And then we're going to circle back as a group just for a couple closing thoughts. Thanks, everyone. Welcome back, everyone. I think we're just going to give it another 10, 15, 20 seconds before all the breakout groups come back. It's great to see so many more cameras on.
Great. Well, just to close, Adam and I don't have any, final big words of wisdom. I think we heard a lot of interesting ideas. Certainly in my room, we were just getting started talking about recruitment and retention and just the new timeline, the lengthy timeline it's requiring to recruit strong talent. Alicia Hawley gave us a really great idea. Remo is a platform that she's been seeing experimented with. It's a virtual conference platform that she said was extraordinarily effective. So it's REMO, I believe, for those of you interested in that. That was a cool takeaway from our room. Curious if anyone else has any interesting ideas, takeaways, tools, tips. that they wanted to share for the good of the order.
Sarah, I'll add that our group had a nice discussion and hadn't seen really the challenges of the Great Resignation at this time, which is great, but are seeing challenges as it relates to being able to stay competitive with salaries. So one of the things that Michelle, you had mentioned from Kessler Foundation was a program to help pay back student loans on behalf of their employees. And that was being well received and people were taking part in that, which was great.
Thanks, Alicia, for dropping that in the chat. Oh, I think that's just to me. I'll put it in the full chat. Well, thank you everyone for joining us again. I think we've left the QR code up enough. Gosh, no one had a better 2020 or 2021 than the QR code. Am I right? Like it was kind of a obsolete technology, but now everyone knows how to use it. So please do use that, use the link. Again, we'll be in touch via email as a follow-up with the full report and additional information. Please do feel free to reach out to Adam or I directly if you have any follow-up questions. And just want to thank all of you for participating in our session on behalf of CCS and wish you all a successful start to the second calendar quarter of the year. Hard to believe we're already almost in April.
Thanks so much, everyone.